I'm cimetidine. My generic name is also cimetidine. My brand names are Tagonate HB or Tagonate. I also have a chemical name, and this is my chemical name. My drug classification is histamine H2 receptor antagonist or H2 blocker. My therapeutic classification is anti-ulcer agent, and my pharmacologic classification is histamine H2 antagonist. My pregnancy category is in category B. My mechanism of action is to competitively inhibit histamine H2 receptors of the gastric parietal cells, resulting in decreased gastric acid secretion, gastric volume, and hydrogen ion concentration. It is also used in patients with pancreatic insufficiency to reduce the breakdown of pancreatic enzyme supplements. My onset is 1 hour. My duration is 4 to 5 hours. In pharmacokinetics, my absorption is to readily absorb from the GI tract. Food delays the rate and slightly decreases the extent of absorption. Bioavailability is approximately 60 to 70%. Time to peak plasma concentration is approximately 1 to 3 hours. My distribution is widely distributed. Enters breast milk, crosses the placental barrier. Volume of distribution is approximately 1 liter. Plasma protein binding is approximately 20%. My metabolism is partially hepatic, converted to sulfoxide and hydroxymethylcimetidine. My excretion is via urine, as an exchange drug. Elimination half-life is approximately 2 hours. My indications are for adults who has benign gastric and duodenal ulceration, GERD, Zollinger-Ellison syndrome, prophylaxis of GI hemorrhage from stress ulceration, prophylaxis of acid aspiration during general anesthesia, non-ulcer dyspepsia, short bowel syndrome, and pancreatic insufficiency. My contraindications are for benzyl alcohol hypersensitivity or H2 blockers hypersensitivity, intravenous administration, gastric cancer, infection, hepatic disease, renal failure, renal impairment, for pregnancy, for breastfeeding, for neonates, tobacco smoking, for immunosuppression, for geriatric, and for vitamin B12 deficiency. My side and adverse effects categorized per body system. In renal is increased plasma creatinine. In gastrointestinal are constipation, diarrhea, flatulence, nausea, and vomiting. In musculoskeletal are musculoskeletal pain and myalgia. In nervous system are dizziness, drowsiness, and headache. In dermatologic is skin rash. In hepatic are cholestatic effects, increased serum transaminases, mixed cholestatic hepatocellular effects. In hepatologic are aplastic anemia, decreased white blood cells counts, pancytopenia, and thrombocytopenia. In cardiovascular are atrioventricular heart block, sinus, and bradycardia. In genitourinary is urinary retention. In endocrine is gynecomastia. In hypersensitivity are allergic reactions and anaphylaxis.
Hi, my name is Famotidin. I am under the drug classification of H2 blocker. My brand name is Flaxid, Dispip HB, Pepsid, and Acid Controller. And do you know Cimetidine? She is my sister. This is my chemical name. And my therapeutic action is I prevent and treat heartburn and other symptoms caused by too much acid in the stomach. And my pharmacologic classification, like cimetidine also, I am a histamine H2 blocker under the pregnancy category, category B. My mechanism of action is I decreases the production of gastric acid, suppresses acid concentration and pepsin content, and decreases also the volume of gastric secretion. I also inhibits both basal and nocturnal gastric acid, as well as acid secretion stimulated by food, caffeine, insulin, and pentagastrin. My onset is 1 hour, and I have a duration of 10 to 12 hours. When administered orally, about 40% to 45% of me is being absorbed and distributed widely to whole or to body tissues, and metabolized 30% to 35% of me is being metabolized by the liver, and most excreted by the urine. My dose is being adjusted to those patients with severe renal insufficiency. I am indicated in patients with duodenal and gastric ulcers, with pathological hypersecretory conditions such as Zillinger-Ellison syndromes, short-term treatment for gastroesophageal reflux disease, and those patients that was hospitalized with intractable ulcer or hypersecretory conditions, or patients who can take oral medications, and also patients with GI bleeding to control gastric pH in critically ill patients. And also, I am being used as treatment for heartburn, contraindicated in infants, neonate, and children younger than 12 years old, not unless directed by the physician. I am contraindicated in patients with phenylketonuria because Pepcid AC chewable tablet contain phenylalanine 1.4 mg per tablet. And these are my side effects. I also have effects on lab tests. I may increase BUN, creatinine, and liver enzyme levels. So before administering us, you need to first do a assessment for possible contraindications and cautions, and also perform physical examination for establishing baseline data, and also evaluate neurological status and perform abdominal examination including liver assessment, inspect also the skin, and assess cardiopulmonary status, and monitor laboratory test results. During administering us, you need to ensure the therapeutic level to prevent serious toxicity. Monitor IV doses carefully and assess any possible drug-to-drug interaction. You need to ensure patients' comfort and reorient them thoroughly. You also need to attend regular follow-ups to evaluate drug effects. You need to provide support and educate the client. After administering us, you need to monitor the patient's response to the drug, any adverse effects, and also you need to monitor the comfort of the patients, and also the compliance to the regimen, and also evaluate the success of the teaching plan.